So what if men could give birth? We often joke about what the world would look like if men could give birth. For example, I'm sure you'd be able to get epidurals at car parks, waiting rooms and drive-thrus, and even get one at 20 weeks if you wanted. This is probably very true because most men, like myself, have a much overestimated sense of pain tolerance. But I think there'd be a number of other things that would be very different also. Firstly, I'm sure we'd have a much better way of testing for gestational diabetes. There is no way guys would be able to handle a test that we have to fast for, takes 3 hours, and makes us slam 75 grams of straight glucose into our system. That glucose makes us feel dizzy, sweaty, nauseated, and just like we want to pass out and lie down. And yet, almost all our women go through this, and that too whilst they're about 6 months pregnant. I am sure that we would have come up with a much better test. Secondly, there is absolutely no way that men would tolerate having a tape measure go from their symphysis pubis to the top of their belly under the guise of estimating the fetal growth. It's humiliating and sensationally inaccurate. This is made even worse when I've got this machine standing right next to me, which is far more accurate and capable of actually measuring the baby rather than just my baby belly. The only tape measures anywhere near a man's symphysis pubis, I find, are generally rigged. Also, and this might be a little bit more controversial, if men were to give birth, I don't think any babies would be born outside of ours. The biggest risk factor to having something go wrong during your birth is to have no risk factors. And that is to say, they're generally unexpected. Birthing in the absence of any healthcare whatsoever has historically been shown to be very risky. And of course, one of the biggest risks is that of bleeding. There are no medical procedures where blood loss is a significant possibility that we're happy to perform at 3 a.m. in the morning as compared to during the day when there's plenty of help around. Whether that help comes from the blood bank, other surgical staff, medical professionals, pediatricians, neonatologists, anaesthetists, and everybody else. So what else do you think might be different if men could give birth?